Hi, I'm Dr. Lorraine Dontigny, Obstetrician-Gynecologist at VM downtown Montreal. Today we have a huge challenge in front of us, and I will take this challenge with Dr. Denise Black. We will cover the therapeutics for mood, sleep, and cognition issues. Dr. Black is a key leader in menopause in Canada. She's also an assistant professor of University of Manitoba. Hi, Dr. Black.
Hello, and thank you again for having me back to talk about this important subject.
We'll start with a huge question for you. And the question is, are hormones helping in any of that?
Well, that's a bit of a complicated question, and perhaps it's going to be easier if we address these issues one by one. In the last model, we talked about the impact of low estrogen, low mood, sleep issues, and vasomotor symptoms on overall brain and cognitive function. So first, let's talk about vasomotor symptoms. Hormone therapy is considered the gold standard for treatment of vasomotor symptoms. So yes, hormone therapy helps with this. And treatment of the vasomotor symptoms may help sleep, if that's what's keeping you awake, and it may help mood if part of the problem is related to sleep deprivation. And we know that improved sleep and improved mood may help overall brain functioning. But the bad news is that menopause hormone therapy does not fix brain fog, and it does not fix verbal memory dysfunction. As we discussed in the last podcast, time alone is the fix for this. So what can we do while we're passing the time waiting for this to fix? Well, the first thing that we can do is look at alternate ways to convert verbal information to other realms. Like, for example, taking something verbal and converting it to something visual can help, because that visual part of your brain remains mostly intact through the menopause transition. So when someone says to you, on the way home from work today, can you pick up milk, bread, eggs, grapes, and orange juice? You think right now you're going to remember that, but I guarantee you as soon as you're out the door, that's going to be gone. So write it down. Make a list. Sticky notes, I believe, were invented so that midlife women could convert verbal information to visual information. So clearly written lists, many ways that you can help to focus, organize your thoughts, and convert verbal information to non-verbal ways to remember it. And please, stop trying to multitask. Everyone thinks they do it so well, and the data actually shows that everybody does it poorly. Focus on one thing at a time. That'll help with the issue of focus. And unfortunately, menopause hormone therapy, it's not the answer to improve brain function, except if it's related to vasomotor symptoms and sleep. As well, menopause hormone therapy is unlikely to reduce the risk of dementia in later life. Most well-designed studies have really shown no overall benefit. The impact of treating severe vasomotor symptoms on brain structure is currently being evaluated. Now, it's unclear what, if any, effect treatment can have on the brain, but I can guarantee you that there is ongoing research into this because this is a priority. So I'm going to ask a question back to you, Dr. Dontigny. Given that hormone therapy is not likely to change the dementia risks, are there any other things that women can do in midlife to improve their brain health?
Definitely. There are tips out there. We don't even need a prescription, and you don't even have to see a doctor to do that. And there are just lifestyle adjustments that can make a huge difference in how you treat your brain. So the first one is that if you take care of your heart, you will take care of your brain. So the same risk factors that cause heart issues or heart problems cause also cognitive issues. So you have to assess if you have high blood pressure, if your cholesterol is too high, or if you have diabetes. You really need to treat them and control them properly to avoid having any cardiac issues or cognitive decline in the long run. Second thing, everybody knows about that. You have to have a good diet and you have to be able to exercise. You need to exercise 150 minutes per week of moderate intensity aerobic exercise to reach your goal. You also have to maintain a good body mass index. You have to have a nice diet, rich in vegetables and fruits and low in fat. And of course, if you are a smoker, please quit smoking. And the same thing holds for alcohol consumption. It's easy to do, or not so easy, but it should be done, and then you help your cognitive function in the long run. We also mention to women to stay socially active. So we know now more than ever that staying connected, having friends, meeting with them is very, very important. And the other thing is that we talked about physical exercise, but you also have to exercise your brain. You can do puzzles, you can learn new languages, anything you're interested in, go for it, try it. So these are all tips that in the long run will help you keep your brain healthy. What about treatment for depression?
So when it comes to treatment of depression and anxiety, we first might consider some lifestyle changes, and some of the things you mentioned are really important. Getting regular physical exercise, and getting regular exercise does as much good as antidepressants in some people. Sleep optimization is important because we all know when we're not sleeping well, mood and mood issues often will follow. But for those that have a resurgence of a previous depression, treatment with whatever worked in the past is what's recommended. And that could be treatment with something like an antidepressant or cognitive behavioral therapy. For women that are having depression in the peri-menopause, so again, that's that period when your menstrual periods start to space out, up until the time when you have been a full year without periods. There is some evidence that hormone therapy may help. Now, higher dose transdermal estrogen along with micronized progesterone is what has been best studied in that group, but that is a specific recommendation just for that specific period. For women that are further away from their final period and experiencing depression, using hormone therapy strictly for the treatment of depression really has shown no benefit.
If we take sleep now, it seems to be a major player in keeping our heart and our brain healthy. Many women describe sleep issue, fragmented sleep, inability to fall back asleep when they wake up in the middle of the night all drenched. We know that behavioral changes in a few things can help these women. And it's pretty much known that watching TV in bed or screen time prior going to bed, cell phone, tablet, computers are bad for sleep. Is there any other treatment you would suggest if all of this is done? We don't watch TV, we don't have any screen time a few hours prior going to bed. What else can we do to improve sleep in these women?
I always start with gathering more information on what is the cause of the sleep issues. I had a patient that came to see me who was saying, well, would menopause hormone therapy help me to sleep better? And I said, well, tell me what your evening is like. Well, she said, I get home from work and I'm so tired that I usually have a nap first. Well, how long do you nap? She said, 2 to 3 hours. And then I get up and I go to the gym. And my dietitian told me that I need to drink at least 8 glasses of water a day. So after I work out, I try to have 4 or 5 glasses of water. And then I watch TV for a while to wind down. And I have a senior dog that I have to give insulin to. And then I try to fall asleep and the dog wakes me up and then I have to get up to go pee. And I thought, well, I don't see anything there that hormone therapy is necessarily going to help. So remember things like sleep apnea, snoring bed partner, restless leg syndrome, musculoskeletal pain occurs more often in women after menopause, overactive bladder, nighttime voiding, These are all things that might be preventing a good night's sleep. So menopause hormone therapy, systemic menopause hormone therapy, is unlikely to help a lot of those issues, but where hormone therapy might help sleep is if vasomotor symptoms are the cause. Now, if vasomotor symptoms are a part of the sleep issues, well then of course use of hormone therapy is indicated, and the data shows that use of hormone therapy in women with moderate to severe vasomotor symptoms does improve their sleep. And probably a couple different ways that it improves sleep. Number one, reduction of vasomotor symptoms, so you're not being woken up by your hot flash or your drenching. But there may also be some neurotransmitter alterations. And some hormone therapies actually have metabolites that have a sedating effect. So that might be a way or a place where menopause hormone therapy can have a benefit. Now, in these situations where nighttime voiding or overactive bladder is part of the cause, use of local vaginal estrogen products can really result in improvements. I know that in some circles there's the popular mythology that being on hormone therapy fixes everything and makes you feel 25 again. What we know is this: vasomotor symptoms and some of the symptoms that are caused by vasomotor symptoms like sleep issues, sleep deprivation, mood issues associated with sleep deprivation, that is an indication for hormone therapy, and that is likely to be fixed by hormone therapy. Now, if people are having discomfort and anxiety related to their vasomotor symptoms, that's something hormone therapy can help with as well. It's interesting that among women who are working, their primary reason for choosing to go on hormone therapy is to continue to be able to function at work. And if vasomotor symptoms at work are causing them issues, if not being able to sleep at night because of vasomotor symptoms are causing an issue, then that is a place where hormone therapy can be helpful. But hormone therapy is not going to fix brain fog. It's not going to fix depression, except for those women in that peri-menopausal period, and it's not going to fix sleep issues that are unrelated to vasomotor symptoms, with a very few exceptions. So having reasonable expectations is vital. It's not the answer to everything, but it may be the answer to some things.
Thank you so much, Dr. Black, for enlightening us about the therapeutics of issues concerning mood, sleep, and cognition. I think it's encouraging and I think it's comforting to know that there are things out there that we can do to help us all. Thank you.
Thank you for having me.
This concludes our second segment on issues on sleep, mood, and cognition. Stay tuned for other podcasts on menopause. See you soon.